Hello, thank you for tuning in today to our weekly COVID-19 update. I'm Dr. Barry Pecos, York Region Medical Officer of Health. I have two important messages for you today. One of excitement and hope for the beginning of the age 5 to 11 vaccination campaign, and the other with some concern relating to reports of the new Omicron variant of concern globally and here in Canada and York Region. I share parents' excitement in being able to vaccinate our children 5 to 11 years old. Not only will the vaccine protect children from illness and prevent them from passing it on to parents and families, but it will help them stay in school in person and bring an end to the significant disruption to their lives. Children who get vaccinated in the coming weeks can look forward to their second dose close to the end of January and then being considered fully vaccinated by February with all the benefits that that brings. Last week, York Region began offering appointments to COVID-19 vaccines for children 5 to 11 years old. We opened up more than 12,000 appointments in community, school-based, and pop-up clinics. I'm thrilled to see that over 95% of those appointments were booked within the first 2 days. Our York Region appointment booking system offers appointments for the next 10 days, so new appointments become available every single day. Please check back often, and if you haven't already, I urge you to book an appointment online at york.ca/COVID-19 vaccine or by calling Access York at 1-877-464-9675. There are also appointments through the provincial system at Cornell Community Centre in Markham. We continue to work with local school boards and launching more school-based vaccination clinics at targeted school locations, in addition to allowing 5 to 11-year-olds to access pop-up clinics and community clinics across the region. School-based clinics will operate on weekends outside of school hours. Recently, York Region also hosted a special vaccination clinic for those age 5+ who may have anxieties or fears around needles or vaccinations. That clinic helps reduce anxiety with longer appointment times that are allotted for individuals to receive the enhanced support from staff that they need. The clinic staff and immunizers are trained to support individuals with needle anxiety and provide coping mechanisms. We look forward to hosting more special clinics like these throughout December to meet the needs of our residents and encourage further vaccination to protect our community. No matter what type of clinic you choose to visit, please remember to be kind to those administering vaccines and enforcing public health measures. As we look to the community, though, we're seeing a gradual increase in cases across the province, with the highest case numbers since May recorded yesterday. Unfortunately, this is not good news and may potentially put some of your holiday plans and our hopes for a new year in jeopardy. If you haven't already, though, now is the time to get vaccinated. Celebrating safely with your family is something we can all look forward to this year, thanks to vaccination. We also wish everyone celebrating Hanukkah this week a happy and safe holiday. Within the community, there continues to be outbreaks within our hockey and sport-related activities. Most of these are small, but cases are impacting many of our youngest residents and under the age of 12 and preventing them from going to school in person. This serves as an important reminder for families and individuals participating in hockey or any sports to get vaccinated. Even one dose of vaccine is somewhat protective. Once you're fully protected with 2 doses, your play will be far less affected by COVID-19 and you won't need to quarantine if there's an exposure on your team. Get tested as soon as symptoms develop, even if you're fully vaccinated, including if your symptoms are mild. And make sure you stay home when sick, again, even if your symptoms are mild. Don't share water bottles or other personal belongings. Ensure that you're wearing masks and practicing physical distancing as much as possible, and wash your hands well and often. If you can, come dressed and ready to play sports as much as possible and limit time inside change rooms. I know this is a practice with my 3 kids who play hockey regularly. It's an exciting change, but it's really necessary and important to prevent spread of COVID-19 in sports facilities. With high school transmission low in York Region, we're happy to see the province now announce that secondary schools will be able to return to regular in-person learning with our regular semester schedule as opposed to the modified semester. This means students will participate in 4 75-minute course periods each day compared to the current modified semester system. Much to these students' delight, York Region Public Health endorses this decision, and the change will happen in the coming weeks. This change is due to the high vaccine coverage among York Region's 12 to 17-year-olds, which is currently at 87.4 with 1 dose and 84.1 and 2 dose. We continue to closely monitor the rate and number of COVID-19 cases and exposures in our schools, and we will continue to rapidly apply targeted interventions as the situation warrants. If you're in high school and not yet vaccinated, please make an appointment as soon as possible to protect yourself and your classmates and make sure everyone can continue to attend in-person school. As you're likely aware, the Omicron variant, which had only been identified as a variant of concern last week, has now been found in Canada. There are no cases in York Region, but processes are underway to ensure that we'll be able to detect cases if they do appear. Several countries, including Canada, have already implemented travel restrictions to limit and prevent the introduction of the Omicron variant in our region. The Omicron variant does seem to be more transmissible than even the Delta variant and has a number of mutations that may make the vaccine less protective. This is only speculation at this time, and it's going to take several more weeks to confirm whether or not the Omicron variant is a significant global threat or a threat to Canada and York Region. We'll keep you updated as new information emerges. Whether you're at school, work, or out in the community, I encourage you to stay safe, stay informed, stay vigilant, and please get vaccinated as soon as possible. Visit york.ca COVID-19 vaccine for COVID-19 vaccine clinic locations and hours.